Hey, welcome back, everybody. It's time once again for another episode of Health Talks with Dr. Trinh. The one show, maybe the only show that shows you the path to a healthier life, one conversation at a time. And today, well, we're going to talk about something we've never talked about before. It seems like we're doing that every week these weeks here. Dr. Trinh, explain about medically tailored meals. I don't even know what that can imagine here.
Well, Paul, you know that I speak for food.
Yeah, you like food.
This is my favorite topic. When it comes to food. I want to introduce you guys to Steve here, CEO of a number of organizations. The one I'm familiar with is Project Food Box and Centera, I think. And we're here to talk about why and how food is medicine. And Steve leads that. I met Steve recently at our OC Senior Day, where we hosted with Memorial Care and the team. So it was really good talking about his services, his work with, I believe, CalOptima and pending work with other health plans to deliver food to folks who need it. Not just regular food, but food that's tailored to their disease or to their health conditions, which is really neat because in truth, food is medicine. Welcome, Steve.
Thank you. It's great to be here, Dr. Trinh. Good to see you again.
So will we ever get to a point, Steve, where doctors will prescribe food instead of pills?
Well, I think we're kind of there right now. Thank you guys for having me aboard. And Dr. Trinh was right. We are working together with CalOptima to provide medically tailored meals to those that are suffering with chronic health conditions and have recently been released from a hospital, et cetera. And they ran the pilot program for this program back in 2018, and the results were strong enough for them to conclude that the addition of healthy diet and direction and healthy foods, create healthier people and healthier outcomes. So this is a program that we're excited to partner with CalOptima on, and as Dr. Trinh mentioned, other counties soon.
All right.
Tell us your story. How did you get started with all this?
Wow, it's a great story, and I started a company called Centera in 2000. I'm a lifelong member of the produce industry. I grew up in a small town called Brazeel, California, out in the desert, if anyone's familiar with that. And there's not much there besides agriculture. And that's what I learned to do. Worked alongside my dad, whose job it was to gather farm labor and help farmers get their crops harvested. So kind of learned everything from the ground up. And our business was growing and continuing to be successful. And then the pandemic hit. And when the pandemic hit, it turned our business upside down and many others just like ours. Half of our customer base, we didn't realize that close to 60% of the produce that we grew was destined for restaurants and schools and hotels and a lot of those industries that were severely impacted from the pandemic. And so one of the USDA's responses to that was a program they put together called the Farmers to Families Food Box Program. And so that program involved contracting with distributors like Centera to purchase these healthy fruits and vegetables that farmers couldn't sell due to new market conditions and move those to food banks and faith-based organizations and community groups. And that was pivotal for us because it put us in the room with people that we otherwise may not have been in contact with. Put us in the room with people who were actually implementing solutions on the ground at the time. And so, we were able to partner with both local food banks, Orange County Food Bank and Second Harvest, as well as many, many others throughout the state and really the Western U.S. and even had a fantastic partnership with a faith-based organization that was working on the Navajo Nation. And we were able to deliver 250,000 boxes to the Navajo Nation during the pandemic. So, that program was a lifesaver for us in terms of keeping jobs, keeping our facilities going, keeping our trucks going. It really was what it was intended to do. It did what it was intended to do. And then a year after, when that initial funding dried up, obviously the needs in our communities didn't. And we were able to partner with these food banks up and down the state and throughout the West Coast to continue to pack those fruits and vegetables, and still do to this day. And we've packed close to 4.5 million boxes that we've delivered to communities through these food banks and organizations. Wow. And I bring that background up to explain how we got even in the position where we were able to execute a food as medicine program. So when CalOptima reached out to us, they were familiar with our ability to pack these fruits and vegetables and get them to food banks, but further challenged us with nutritional assessments and direction on the specific ingredients of the box, and eventually home delivery, all these components, which are very challenging in and of themselves. And we've been able to do that. And so we've been working in the community for the last maybe 6 or 8 months, specifically on this program, and have delivered thousands of boxes directly to members, Medi-Cal members' doorsteps, with boxes that are custom built for their medical condition.
A lot to unpack there. So let's see if we can break it apart here. So you come from I'm assuming generations of farmers here?
Yes, my family's originally from Yuma, Arizona, and then my parents moved to Brazeel. And my dad was, we weren't the landowning kind of farmers. My dad worked and operated in a lot of businesses that were ancillary to the farming business. So service, whether it was fertilizer sales or transportation or labor contracting, things like that. So, but my family has been in the agricultural industry for as far back as we can count.
And Brazeel, for those who don't know, I got to go look it up. Isn't it somewhere past Palm Springs? It's somewhere out in the Inland Empire there?
So we're about 30 miles from the Mexican border and about 50 miles from Yuma, Arizona, which is on the California-Arizona border. So heavily, right near the border, heavily agricultural. And yeah, that's where I'm from, small town.
So that area out there, from all that kind of, I know there's a name for it, but that whole area out there, people don't go out there too often. There's nothing that tracks you out there. There's no Disneyland out there. There's no giant tourist attraction out there. It's all agriculture. Because I'm always marvel. I inherited a second home out in the Palm Springs area, and every time I drive out there, coming in, I'm going out towards Palm Springs. Coming in are trucks, loads after truckloads of, I see onions and all sorts of other crazy things. And I'm like, where are they coming from? They're coming from where you're talking about here, this area of California that grows all the fruits and vegetables.
Exactly. The Imperial Valley, as we call it.
Valley.
And so, it's the winter salad bowl. So if you're enjoying any kind of leafy green vegetable from Thanksgiving to Easter, approximately, it's coming from either Yuma or Brazeel, Yuma or Imperial Valley. And then the whole industry transitions up to, Oxnard, Santa Maria, Salinas during the summertime when the weather is more favorable.
So explain to me one question. It's the desert. How do they grow anything out there?
They have a very unique and amazing irrigation district out there called the Imperial Irrigation District that executes one of the most sophisticated irrigation systems in the world. And all of us have been reading about that if we've been paying attention about the new water agreements and what the challenges those might bring, and farmers needing to do more with less. And that's kind of what led us, another one of the initiatives that Dr. Trinh mentioned, Elevated Foods. It's a separate and independent organization that we formed to really help farmers transition from the old way of doing things into the more new way of doing things, doing more with less. And
in the old way, they would literally flood fields and other sorts of things. It's what I've read. And now with the severe restrictions agreed to by the Compact of States, they're going to have to go down to what, like 50% less, 90% less, something dramatic here.
Yeah, significant water challenges out there. And so you're going to see the implementation a lot more of a drip irrigation system, more precision agriculture in terms of how we irrigate. But we also have to remember too, a lot of this stuff needs to be balanced with what the land needs and what the field needs. Like for instance, if you don't flood irrigate, let's say for a couple of years, the salts will come up from, part of that process is it leaches the salt out of the soil. So it's actually available to grow a crop, right? So some of these things present tremendous challenges because on the one hand, obviously, one would think it doesn't make sense to just flood a field. But on the flip side, if you don't do that and in 2 or 3 years your yield is cut by 75%, then what have we done? So sometimes there's some unintended consequences of these challenges, which make them so difficult to negotiate through, as we saw.
How did we get, this must have happened after World War II, how did we get irrigation in a desert like the Imperial Valley? How did that become a place to plant crops?
Right. So, I'm not super familiar with all the specific details, so I don't want to get too far out over my skis. Yeah. But I know that was an area of the country. The soil was rich and it was short of water. And at the time, I don't think people were thinking about what the water situation might be 150 years into the future or 100 years into the future, and just saw it as an awesome opportunity from a weather window to be able to grow crops at a time of the year where they just simply can't be grown other places. Right. And with yields that are with the sunshine and beautiful weather we get out there. For instance, an alfalfa or a hay crop might get 8 or 10 harvests, where one in an intermountain state up in the rock, in Utah, Idaho, et cetera, might get 3 cuttings because their window of weather is a lot shorter than ours.
Wow. So they can
there's a lot of positive. Yeah, there's a lot of positive attributes, but I think what you're going to see over time is you're going to see farmers are very resilient. We will grow whatever the market will bear, as long as it makes sense for our ground and our people and our equipment. So I think we'll start seeing maybe a transition of some crops into others. We're seeing a tremendous amount of solar going out there in the Imperial Valley as well.
Right.
So there's a lot of things going on down there. But as being somebody from a small farm town, I worry and I wonder about when less water means less acres grown mean less jobs. These communities, like where I'm from, are extremely challenged as it is. And when you take away the jobs, it just creates some significant challenges. So there's a lot for us to think about.
Right. Okay. Well, you're the first person we've ever had on from Brazeel. So I gotta get a little of that in there so I kind of understand what's going on. All right. So your program then started out of a need because how did we get so far removed from the farmer? There used to be a day when the farmer fed his family and took his crops into town and sold them. And of course, that's 100 million years ago. Then we started creating distribution chains, and we started creating grocery chains and other sorts of things. And I wonder how long it takes for your fruits and vegetables out there to reach my table. It's got to take a long time.
Exactly.
And a lot of people.
Yeah, so that we find that interesting. And even being from Brazeel, we'll have some local chains down there, and we'll see our own product in the store, but it's 4 or 5 days after we ship it, even though we're across the street, right? Yeah. So in the interest of distribution efficiency, and in the era of consolidation, mass retail consolidation, we're seeing Albertsons and Kroger trying to combine now, which would create a massive organization. Yeah. And what that does is it creates a need to acquire produce for some of these chains at a mass scale, and it only allows them to work with a select few growers that have this sophistication and ability to deliver, let's say, 100 truckloads of watermelons to a particular chain store on a weekend, and not 1 or 2. So to your point, Paul, about the farmer feeding his family and loading up the pickup truck and bringing what's left over, those days are gone, because the efficiency, the sophistication it takes to sell a retailer like a Walmart or a Costco or a Kroger is beyond the scope of these smaller family farms that you're referring to.
So to put the farmer in a place where he doesn't even know where this is going, and maybe he's a corporation now himself. He's got a giant operation, giant equipment, giant distribution, everything here. So he's like any producer. He's producing stuff into a supply chain. He may not even ultimately know where it's going anymore. He's selling to somebody who sells to somebody or moves it. I guess my point is, why suddenly come back and create a direct relationship with consumers like you're doing with CalOptima and you were doing with food banks? So I understand some of the economics. So walk me through that again. Why is the farmer suddenly stepping back in and selling the food directly to people here?
Right. Well, because we're providing an opportunity for the first time in a long time. And I think you're right. I think, COVID, and actually it wasn't necessarily in the beginning of COVID. In the beginning of COVID, we saw the toilet paper and things like that.
Right.
And then, but when you start thinking about when freight prices started quadrupling and the supply chain really crippled, I think in the produce business, I think we were extremely efficient and fought our way through that. But I think the greater population came to realize that this is a lot more difficult than maybe we've been thinking it is and taking advantage of. We just assume when we order a salad, it pops up on our plate.
Exactly.
And I think that this pandemic and the following and resulting inflation around all the costs associated with it really shined a light on it and really kind of showed that, wow, we better pay attention to where our food is coming from. And that's why we created, Elevated 2 is really just to create that supply chain transparency. So to your point, these customers that we're selling to know that these are dedicated plants, know everything about those plants, know everything about the production schedule, really kind of link arms with suppliers to make sure that their supply chains aren't disrupted. So I think there's this, and I'm a father of 4 kids and they're age 18 to 28. And my kids like to know where their food came from.
Yeah.
I grew up in an era where an apple was an apple and an orange was an orange and you just ate it and moved on. Now it is that a Cosmic Crisp apple? Is that a sugar bee apple? And they buy with their eyes, but they also buy a story too. They want to know that the farmer they're dealing with shares their values and the product that they're going to support accordingly. So you're right. I mean, this supply chain transparency that is becoming more prevalent is becoming critical to sell these major retailers because they've made promises to their shareholders, to their stakeholders, to the greater world of some of the things they're going to do, and now they need to lean on their supply chain partners to actually execute on the promises that they've committed to.
And
speaking of stories, what is the story behind going from growing your produce to now delivering medically tailored meals?
Right.
Wow. I mean, like when we first started conceiving of this concept, we thought, okay, we know we have a tremendous source of supply with growers all throughout the U.S. that we've developed over 30 years in business and access to virtually any type of fruit and vegetable and any kind of quality we wanted. So we felt really comfortable about the actual produce piece, actually making an awesome box and putting it together. The challenges around these kind of programs really become around the enrollment and education and ongoing support, right? So it's the outreach that we had to learn how to do. So being at a community, going to your event, Dr. Trinh, doing interviews like this, I'm on Zoom calls probably, 20 or 30 a week, talking to different community groups, community organizations, hospitals, healthcare systems, et cetera. And so really engaging with the population that we weren't super familiar with. And I think we're doing a really good job at that. And then I think the key piece too is this registered dietitian piece that is necessary for us to diagnose, if you will, and prescribe a box of fruits and vegetables that are specific to that member and really tailored to their likes and dislikes. Also, it's critical in my mind, to provide food to people that they're actually going to eat. And so there's
a radical idea. We can tell you all the things
you
should eat, but how about stuff you will eat?
Right. And then so there's some education that we're excited to start working on around, items like cauliflower or Brussels sprouts or, items that would typically be out of the reach of this population who might not be interested in paying $8 for a head of cauliflower, but would enjoy trying it if they knew some innovative ways that they could enjoy it. I always joke that my wife has a great way of fooling me into mashed potatoes and I eat them. And then she goes, that was cauliflower. And I was like, okay, so there's some interesting ways to do that. So when we started puzzling this thing together, we thought, okay, we can do the community outreach, which is necessary. We feel confident. We've been working with community groups since the pandemic during that box program. So that was very helpful. And then we knew we could work with the RDNs because we had already identified several that were that I'd known from other things that I'd done. And so we're able to delivering it to someone's doorstep and utilizing what we're going to deliver to into one system that then spits out the most efficient route for each one of those delivery vans, like those types of things.
Are we going to see a shortening of the supply chain? Is this maybe one of the unintended consequences of COVID, where you're going to see more direct farm to table programs or getting food faster? That was supposedly Walmart's claim for their food stores, is that somehow they didn't all go to some distant distribution center and then come back to the store somehow they got it to the store faster. I don't know if that's true or not, but that was the claim.
Yeah, I think the direct to the consumer model will only expand to grow as growers get more creative with how they market their products, and people get more familiar with ordering those items. But you're right. I mean, that's exactly what we're doing. We feel that with this program, we're providing and creating an alternate supply chain that did not exist before. And so the exciting thing about it is when we've been working with growers directly, and as you might imagine, sometimes you go to the store and the produce is packaged in these beautiful packaging with all kinds of colors and excitement. And that all costs money, right, to put it in that beautiful package. Oftentimes the packaging rivals the cost of the product. Wow. And so when we're able to work closely with farmers to identify the items we want to buy and eliminate all that redundant packaging, not only does it eliminate just unnecessary packaging, but it drives costs out of the system. And so we're able to work directly with farmers to access the crops at their field level, bring it into our central facility where we get it packed and distributed out. Really cuts out 2 or 3 pieces of the supply chain. And I was referring to that story about going to a local store in Brazeel and seeing my produce but a week old. What happened? We did a little bit of research and we loaded a truck, like let's say on a Monday. It got up to a distribution center in Los Angeles on Wednesday, sat around there for a couple of days, and then went on another truck that was fully mixed with items back down to Brazeel to some of their stores. And it was like, wow, there's got to be a better way. And so this improvement and kind of driving efficiencies through the supply chain, I think is something that we're really seeing and really excited with this program with Medi-Cal, which is a Cal-AIM initiative, which means it's statewide. So there's 58 counties in California. Every one of these counties is eligible to roll out one of these, food as medicine programs. Typically, a lot of these programs utilize prepared food, microwavable food, frozen food, which are really awesome for those folks who maybe don't have the ability or desire to break down fresh fruits and vegetables and eat them. But we're seeing an overwhelming demand on the other side for people who want whole, fresh foods that they can create and build on.
And who are these people? You're talking Medi-Cal, so these are people who are lower on the income scale here. They qualify for some sort of assistance. This is the population, Dr. Trinh, that eats the poorest, not just because they're poor, but because they seem to be in jobs or in cultures or whatever where they're eating fast food. I'll say crap food. They're not eating good food. They're not eating a lot of fruits and vegetables for whatever. Talk about that. You're not just bringing food to people who are ill. You're bringing food to people who have very limited packaged, highly salt, highly sugar, highly fat kind of diets here, right?
Yes, this is a group of folks who are relatively more unhealthy. Sometimes it's expensive to go and just buy organic food and things of that sort, and it's much easier to get fast food and probably cheaper. And so these are folks who could use some assistance with really healthy food, right? That is designed and based on their primary diagnosis, whether it's heart disease, kidney disease, diabetes, and things of that sort. So my understanding, Steve, is you deliver that type of food box depending on their conditions. Is that right?
Correct. So we have 6 different box types that were outlined by CalOptima as kind of the building blocks, if you will. So the disease states that you mentioned, so diabetes, heart challenges, renal challenges, cardiovascular, obesity, a lot of these different challenges. And then once we interact with the member on a virtual RDN assessment, then we further kind of dig in and find out specifically what the challenges are, their relationship to food, likes, dislikes, any cultural preferences that they might want or not want. And then we further customize the box to specifically meet their individual needs. So no 2 boxes are the same. Every week it changes due to seasonality and freshness and availability, and delivered every week directly to their doorstep. And we're starting to see what's really great about this program is after the initial 12-week delivery cycle, then we do a second nutritional assessment. And that one to me is very critical, because that one, now we've had them receiving these awesome, healthy, fresh fruits and vegetables for 12 weeks. And then we get a chance to see if there's been a reduction in rehospitalization, if there's been a reduction in any kind of medication, any weight loss, any gains. And then we're able to authorize them for an additional 12 weeks to really get them on their journey to enjoying these fresh fruits and vegetables. And Dr. Trinh, you know better than anybody, these behaviors are learned behaviors over time. You eventually start integrating these foods into your diet, and the goal is for them to become a standard part.
So let's talk about that for 1 second here. We've had on, not this program, but on our station, I don't know if you guys are familiar with, I think we should get him on this show, a chef named Bill Bracken. He was a chef at like the Four Seasons in Beverly Hills. He got laid off, and rather than go work for another fancy thing, he said he was going to buy a food truck and he's going to feed the homeless. And so he went to his friends at hotels and places and stuff and started collecting stuff. And it was a lot of fancy food. It was a lot of healthy food because that's what he had used to. He was a trained chef, and he knew how to source this stuff and get it. And a lot of it was left over at these hotels. He started bringing it to homeless people in food truck in Santa Ana through a thing called Bracken's Kitchen. It's now expanded exponentially. But he found that the food he brought them, which was healthy and tasty, they turned up their nose because they'd never seen cauliflower. They'd never seen stuff that he was bringing them. And he was like, what do you mean? This is great food. It's great for you and it tastes great. And people were, well, I don't know. Where's the Fritos? Where's the Twinkies? Where's the meat and potato that I'm used to eating here? Talk about that, Dr. Trinh. It's not just getting people food, it's getting them to eat it.
Absolutely. That's where the education comes in. And letting them know that that this type of food will improve their health condition or stabilize it, reduce the risk of them heading back to the ER or hospital. And folks with kidney issues may not know that they shouldn't eat a lot of potassium in their food, and what food has potassium and what doesn't, right? And so a lot of good education there. Heart disease, you don't want a lot of sodium to cause fluid accumulation. So the education is a significant component of this. And once folks realize that food is their medicine and that they feel better and that they've lost weight and they get their health benefits, then it really encourages them to continue in that route with the diet.
Because many of these impoverished communities or these immigrant communities, they grew up eating not healthy stuff, fried food, fast food, lots of sugar in their food, lots of salt in their food. And I'm always amazed. People who are struggling to buy food in many cases are the ones with the most food problems and diabetes and overweight and all these things you would think would only be those who have more than enough food. It's the people who have not enough food who aren't eating even the right food, right, guys?
Yeah, but in speaking specifically to the population that we're serving, that was one of the first questions I asked when we were talking to different managed care plans, just so I can get an idea from a business process, like what kind of population are we talking about? Is this something we can do within our existing operation? Do we need to invest to expand our capacity, et cetera? And, this was a year and a half ago or so with one of my early kind of discovery calls and doing some research. And when thinking about Orange County specifically, when they asked me if I knew how many people in Orange County had Medi-Cal coverage, I kind of thought about it, and they said there's a population of 3 million approximately. And I said, 100,000, 150,000,
no,
200,000.
It's like a million or something.
and they told me it was 978,000. And I about fell out of my chair, and that's when I realized, like, wow, this is something that's significant. And then when you extrapolate those numbers across the county, across the state, the numbers are very similar. And so that puts it at 13 to 15 million people in the state that qualify for these types of programs. And then specifically, when I look at Imperial County, my hometown, it's north of 50%, 60% of the population has Medi-Cal coverage. So there's a significant amount of people. And to the points that we've discussed, there's no shortage of fresh fruits and vegetables. There's plenty of fresh fruits and vegetables of all different types, sizes, varieties. It's just a will to make it happen and to get it to the people who need it the most.
So how do you get them educated about the benefit of this? Is it Cal Optima's? Is it the doctor? Is it your program? Who's who's telling people the benefit of eating these foods?
So that is one of our responsibilities and challenges that we've taken on. So we're we have an area of our website and through our call center where they can access different types of recipes and all the threshold languages that are present here in Orange County. And by the way, which is 7, so we have to be able to offer our service in 7 different languages.
Wow,
so,
give me a quick overview. We've got Spanish and Vietnamese. What other maybe?
You got English, Spanish, Vietnamese, Spanish, Chinese, Korean, Arabic, and Farsi. And so, yeah, there's significant different language challenges that we have here. But you're right, it's the educational piece, and we're really starting to look at how we beef that up through our reauthorization process. Right, once we have these folks on the phone, we can ask them any myriad of questions that would help us better understand their health and how what their relationship with food is and kind of what that looks like. So, this being able to communicate with the membership has been probably the most rewarding part of this program, because we really get to interact on a personal level with every single one of these members. I always like to say, if you have a free type of a benefit, people don't just come running and sign up and no questions asked. They want to know what this program is, what's it all about, who's running it, where's the food coming from. Right. They have all the same questions that you and I would have when we source our food. And we're so proud to be able to tell them that we're working directly with farmers to bring this. And I really find this really at the gist of it, which really gets me excited about it. And you very seldom see big farm groups in alignment with social services type groups or those types of things. They just don't operate in the same circles. And to be able to see a program that really addresses tremendous challenges that farmers are facing in producing crops that they can make a profit on and keep their businesses sustainable, and to actually have them to participate and be part of the solution to our community's health challenges is, I think, an awesome opportunity to tie these two groups together. To, as we mentioned earlier, that someone mentioned it before, we've been talking about, food is medicine, medically tailored meals, all these names are now getting acronyms. So MTMs, medically tailored meals, and FIM, food is medicine. But someone used one the other day that I might steal, and they were saying food is health, and food is health. And that's really kind of sums it up. It makes it sound like less clinical than food is medicine. So I kind of enjoyed the food is health kind of description of it, and really bringing together our communities. And the thing that's beautiful about it is we're sourcing local produce to solve local needs. So as you know, there's not a ton of commercial agriculture left in Orange County, but the very few that are, we work with. And then, when we plug into other counties, we'll be sourcing from their local growers, because it really is a community activity where these farmers can feel they're making a positive impact.
This was called Orange County for a reason. There used to be lots of fruits and vegetables here, but it's all been replaced by homes like mine. All right, so walk me through the mechanics of how do I get this food? Who pays for it? How often do I get it? Where does it come? Go. So I'm on Medi-Cal, and who starts me and says, "Hey, we got a program here that might make you healthier"?
So we typically work with different community groups, healthcare organizations, or we're always out in the community having tables at various resource fairs, health fairs, various community events that we work with, and really just to create awareness. Our job is to create awareness about the program. The beautiful thing about this program is a member can self-refer. So a member can raise their hand and say, I live in Orange County, I have Medi-Cal through CalOptima, and I have diabetes, and I'd like to participate in this program. And then we're able to help them. They don't need to go through a myriad of lines and doctor's notes and approvals and all that type of thing to get into the program. So once we make contact with them, we obviously, we are able to confirm their eligibility. We're directly linked into CalOptima's system, confirm their delivery, details, make sure, and many times we're updating phone numbers and addresses. As you know, we're all pretty mobile in this new day and age, and we don't stay places very long sometimes. So we're able to update that information and really then tee them up for the nutritional assessment. And that's a short, 10 or 15 minute call with an RDN that, again, kind of goes over their various different measures.
And are these in multiple languages, or do they have to do this in English?
Yeah, so our staff is English, Spanish, and Korean currently. We're looking for some other staff members, but we have an on-demand translation service that literally has hundreds of languages. So we're able to actually communicate with every member in any
Well, I'd
language.
suggest using Dr. Trinh as a Vietnamese translator, but he doesn't speak Vietnamese very well. He still says all the wrong words. Even I know some of the words that he doesn't know here. So
yeah, I'm fake Vietnamese. Fake Vietnamese.
Exactly. And then and during that interview, we're able to learn a little bit more about their relationship with food and health and where they're at and the challenges that they're facing. And then from there, the registered dietitian will actually write up a nutritional assessment and create a recommendation for that member based upon their chronic health conditions. And then we get authorization at that point from CalOptima to say, yes, Mrs. Smith is in our system, hereby confirmed. Go ahead and deliver them 12 boxes a week, 12 boxes during this 12-week period. And then we get to work and get it delivered.
So it's a weekly box, and walk me through. I'll get a typical box. Let's say she has diabetes, for example. What would I expect to get inside that box?
Right. So our boxes are 15 to 18 pounds of fresh fruits and vegetables. And our RDN has been able to really kind of simplify it for us by categorizing. So like in the diabetes category, there might be 40 or 50 vegetables that are acceptable to go in that box. Dr. Trinh, you mentioned kidney or renal challenges. That box is severely limited as compared to some of the other boxes, right? That one's not as fun as some of the other boxes, let's say. But then you have somebody who's got immunity support or cancer support, and they get to have all kinds of lots of more fun items in there that they're not looking for a reduction in sugar and all these types of things. So, our boxes, pretty much all of our boxes have strawberries, blueberries. We really like to include items that we think are going to be excitable to get. We all know when we've seen people go to food bank and you get a box that has a couple of potatoes and a couple of onions and a couple of oranges in there and they call it good. And it's kind of hard to make something like that. So we like to deliver an eating experience to our members. Persian cucumbers, those little bags that you see like at Trader Joe's, those have been like a phenomenal, everybody loves those. Those have been great. And really we've had asparagus in there recently, blackberries, because of our ability in that getting back to that supply chain of produce gets harvested or arrives on our dock, let's say today, this morning, or maybe it arrived last night. It'll be packed in a box today, and then tomorrow morning it's on someone's doorstep in Santa Ana. So it is faster than what a traditional retailer could get food.
And how do they respond to Persian cucumber? I wonder if there's other, because I know there's all sorts of oddball stuff being grown. I call it oddball. It's oddball to me because I've never heard of it or seen it, but it's probably tasty. It's probably healthy. And I know there are farmers growing this stuff, experimentally trying to expand our palates and expand their products and all these things.
Right. So those are the challenges. So the Persian cucumbers are those little snacking cucumbers. So my wife has replaced those with crackers. And so now we get to eat, we use those to dip in ranch or do something like that. They've been very popular. But you're right. It's whenever we kind of get out and get a little excited and put bok choy or Napa cabbage or something like that in there, then there'll be an uptick of calls. But what really makes it interesting is then they're not upset about it. They're just saying, hey, tell me what I can do with this. And then we point them to some resources and tell them what they can do with it. And a lot of times they come back and go, wow, that was really good. Make sure to put that in the box again. So, as we refine the process and grow in these different counties and really kind of dig in, Dr. Trinh, you've nailed it on the head. It's education around how to utilize these items.
So this doesn't cost the patient anything if they are CalOptima. Is that right?
Correct. Yeah, I didn't finish that out. So so this is a free benefit to them. I've kind of, when I talk to my friends, I kind of refer to it, I have private insurance for my dental care and I get 2 free cleanings a year. And I always joke that they don't give me those because I'm a nice guy and they want to give me free services. They give that to me because they don't want me to hit them for a $20,000 dental surgery in 2 years. Right. And so I liken this, in my head, I kind of liken it to the same program, which is doing this preventative stuff to save the long-term diabetes diagnosis and all the healthcare that's associated with that for the entirety of their life. So that's
Will this ever expand into the mainstream, into regular Blue Cross kind of programs
Yes.
or whatever?
Yes. I think that's the next natural progression. We see a few different progressions. We see one for it to be utilized with CalFresh or SNAP dollars so that people can utilize once they're off the program, let's say, and they have to actually start purchasing fresh fruits and vegetables. We're working to develop an offering that they can utilize their food stamps, their CalFresh money to purchase these boxes. And as you know, when you utilize those types of funds for fresh fruits and vegetables, you get 2 for 1 value out of it, $2 for 1. So
I didn't know there was such a program. I didn't know.
Yeah, there's some opportunities for there. And then really, as we think about the greater Medicare population, not just Medicaid, Medi-Cal, but the Medicare population. And then when you think about private insurers, my father-in-law, who's been battling leukemia, got released from the hospital about a month ago. And my wife told me, he's like, hey, they started bringing meals to his door. Now we're all into medically tailored meals. And she was like, it was part of his, I think United Healthcare was his private insurer, had a great job with the water district for his whole life and one of those great insurance packages. And part of his benefit is, after you get released from a hospital, he gets 2 or 3 weeks of fresh meals delivered to their home. So we look at opportunities like that to go, how do we plug into the private insurers, private payers, as well as Medicare to go like, hey, this is a benefit that we could all offer. And now we're seeing these kind of bigger companies that employ thousands of people creating really unique benefits for their members, whether it's gym memberships and discounts at this or Starbucks gift cards or, whatever they're trying to do to entice people these days. But we really see this food is health, food is medicine movement really permeating through all of these opportunities. And I'll say this too. This is a relatively new initiative because for the first time, states are able to use Medicaid dollars, which are the safety net insurance for low net individuals, to be utilized for the purchase of other things other than direct reimbursements for medical procedures. So for the first time, they're able to buy food, for instance, in our particular model. California led the charge on that, first state to do it, but there are 5 other states that currently have that same exemption. And it's my opinion that all or most will have that exemption over the next several years, which will open up the opportunity for Medicaid to start offering preventative services instead of only reactionary care.
Yeah, Medicare Advantage plans, many of them have these supplemental benefits. And some do include groceries as well as post-hospitalization food delivery and things of that sort. So it's actually a movement that's getting pretty popular.
Right, and so in our travels to Sacramento, and we've had a chance to go to Washington D.C. several times over the last several months, meeting with various elected officials and leaders kind of in this field. It's amazing to see the discussion is kind of around the art of the possible. Like, how can we do it? Let's think about we're not thinking, we're doing out here. We're actually executing it in Orange County. And I truly believe that Orange County right now with its Cal Optima program with Project Food Box is at the tip of the spear across the United States in terms of a fruit and vegetable based medically tailored meal program.
We had the new CEO of Medi-Cal in Orange County. What's her name? I forgot her name here on one of our shows here a while ago. And they were talking about how they're trying to be innovative in creating new programs, not just reactionary programs.
Right. And so that's part of the Cal AIM initiative. And so there's 14 new community supports that are outlined. A lot of them are revolved around homelessness, rehoming people, those types of resources.
Rehoming people. What does Medi-Cal have to do with helping you get a home? Because if you're on the street, you're not healthy, and we're going to have to pay for it. Right.
Exactly. And so they call these things in lieu of services, which really makes a lot of sense. It's like you're paying for food in lieu of paying for medical bills for the next 30 years. So I think that's kind of the concept behind it. And one of those 14 new community supports was is medically tailored meals, and we were so fortunate for them to include that in there. And also I think that maybe we at Project Food Box think about it a little bit differently than other people. We're from Orange County. This is a family-run business. We run it as such. We're proud of what we pack. We brand everything that we pack so people know how to get a hold of it, whether they like it or don't like it. Right. And we've kind of taken this, to a different. We're looking at it as a food system, not as like, oh, we need to get that box of food delivered to that person on next day and check the box and okay, now what do we do next? We really see this opportunity to introduce these phenomenally healthy foods to some of the populations that haven't had access to them.
So the obvious question is, You're dealing with government. They want metrics. They want to know measuring. How did this thing work? How long you been doing it, and how's it working?
Yeah, and outcomes is the word that I learned. Every office, every office I went to in Washington D.C., they said we need to know outcomes. And then what I came to learn what outcomes meant was, is this thing going to pay for itself or not?
Right.
So that's really the reality of what we need to prove in our mind. We look at this like, again, micro investment over time and the providing of these healthy foods for a massive back end savings. It's easy to say that out loud, but to your point, data to prove that out, right?
And particularly if you can alter their behavior. If I've been eating
Yes.
fast food, sodium food, sugar food, all the things Dr. Trinh preaches against, that's just the way I was raised. That's all I can afford. That's all I can find in my community, because a lot of healthier groceries and healthier restaurants don't exist in my community. It's the way I was raised. Now you're trying to just bend that curve a little bit here and teach them and introduce them about the benefits of food. That's where a micro investment can have a major payoff, I would think.
Right, exactly right. And that's where we see that excitement. And again, creating customers at a young age, creating people who can develop that relationship with food and realize that food is fun, it tastes good, it's great, it can be good for you. And to your point, it doesn't have to be Cheetos and a Coke. It can be a banana and an apple,
So how is it working? How long you been doing it, and how is it working?
Good. Okay, so we started, we contracted late last summer. We began outreach in October. The very first week, I don't even remember how we encountered 2 people, but we found 2 people that were interested. So I think I paid for more in shipping than the entire reimbursement. And, then the next week we did 10, and then the next week we did 50, and then the next week we did 100. And we're up to several thousand per week now, up over 5,000 per week delivered directly to members' doorsteps. And super excited about, just creating this awareness. And now we're starting to get a little bit of that network effect of family members and friends going, wow, this is for real. And, sometimes we'll post some things on Facebook and 10 or 15% of the people will respond, is this real or is this a scam?
Yeah.
And so what we're also finding is that in this population, there are a lot of unsavory activities that some people try to pull to the scam, for lack of a better word. And so there's a lot of education that we have to go through to go, no, we're for real. We've been here 20 years. This benefit does sound too good to be true. But it's just one of those great opportunities that we'd love you to participate in.
And is it too early to measure outcomes or to get any feedback? What kind of, do you have any anecdotal stories? Do you have any evidence?
Yeah.
What's working?
Yeah. So we're actually meeting with some folks to share some of those outcomes. So our registered dietitian team has seen tremendous improvement in terms of the major metric is rehospitalizations or reduction of hospitalizations. So these are the types of people that utilize the hospital multiple times a month, like those kind of folks. And we're going to be able to, we don't have the evidence completely data put together yet, but there is some number like 97% of the people were not readmitted to a hospital over the last 3 months. Wow. And that might seem like normal for guys, people like us, but again, these are people that use the hospital weekly, typically, or whatever the case may be.
They're old, they're sick, they got conditions that in and out of the hospital a lot, right? Yeah,
and maybe not have the resources to have a primary care physician, so they use the emergency room as just kind of an ER or like a walk-in, So, and those are challenges that we're seeing. We've seen reductions in weight, we've seen reductions in medications, but to your point, those are that we're actually working with different academic institutions to really build some more robust studies around that, because for the longevity of these programs to continue and to grow, I think that we're going to need to provide compelling evidence to say, if we do this, we save that, it's been proven, here's the facts, and really kind of eliminate that doubt that we all know the answer. I think
you're talking to the king of testing, of measuring, of all this stuff. Dr. Trinh, that's what he spends his life doing here with all this medical research that he's doing here. So
right.
Is there a combination of what you're doing with Healthy Brain, Healthy Clinics, Dr. Trinh, and what they're trying to do, healthy food?
Absolutely. Yeah, I would love to put together with you a Healthy Brain box. One of the most frequent readmissions to the hospital are patients with Alzheimer's, back and forth to the hospital all the time because of poor health. in general, and poor nutrition. And if your memory isn't bad, you're going to microwave what's convenient to eat, right? Rather than prepare that type of food that helps with the brain. And so I see lots of different opportunities here to grow.
Are they
that.
looking to expand the medically? I'm assuming Medi-Cal has a certain number of conditions they'll pay for. Would they ever think about brain as a condition that might need a box?
It currently is. It currently is disabling mental challenges and those types of items do qualify. So we have many on the roster currently, and Dr. Trinh, when we spoke about it last week a little bit, it was let's develop a brain box, if you will,
He's
or
the healthy
one
brain guy. That's his mantra here. He's been preaching and teaching and measuring that. Yeah.
Right. And then really kind of, get it down to where I see over time, like a tightening of the ingredients, like as we get better and smarter and we can get more and more targeted to get really specific to these health conditions. And I think those are going to be awesome opportunities going forward.
Well, how do people reach you? How do they find you? How do they get on the program?
Yeah, when they come to www.projectfoodbox.org. We also have a direct line that it's multilingual, as we spoke about, and that's 949-673-0783. We're able to work with people exclusively over the phone. They can come in through the website to get entered into the queue. Our team of 20 or so member success teammates will reach out to them and help them on board, and then our team of 6 or 8 RDNs will get them through that process. And it sounds kind of like an arduous process, but that entire thing happens within 1 week. So if we encounter somebody in the front part of a week, next week they'll get their first box. If we kind of get them towards the end of the week, it'll be the following.
And I'm not on Medi-Cal. I suspect Dr. Trin's not on Medi-Cal. For us, do we have to just wait till our health providers catch wind? Or is there a paid option for any of this stuff here?
We currently do not have a paid option. We've been talking about that, but we have such a tremendous challenge in front of us with the 975,000 we have here. And then I will mention that we're finalizing the contract that we should have any day now with another managed care plan that would take us to Los Angeles, San Bernardino, Riverside, San Diego, and Imperial counties. And I'm excited to work in all those counties, and particularly so in Imperial County, our hometown, and in an area that is probably the most challenged county in all of California. So if we can bring solutions to Imperial County, we can do it anywhere.
And how terrible is that? The people who are picking and growing the fruits and vegetables probably aren't eating them.
Yeah, exactly right. And that's some specific. I was talking to some folks in Imperial yesterday, and I go, that's going to be when the season comes back around in the wintertime, in the fall, that's going to be one of our biggest outreach campaigns is allowing farm workers, access to the awesome fruits and vegetables that they're part of. As you mentioned, that's going to be a great outreach opportunity and a great opportunity to bring those groups closer together.
Well, Dr. Trinh, I'm glad you reached out and brought him along. Sorry I asked all the questions, but this is just fascinating here. And my hat's off to you. Well, I don't want to take it off because my headphones will fly off here. But what a cool thing. What an interesting pivot. It started from a need. Farmers have produce. They can't get it to market. And what are we going to do? So we got to find a new outlet. And you said, maybe we can use this to heal people. How about that? How about using food as health?
It goes from a pandemic response to really a food insecurity response, and I think now it's become a nutritional insecurity response. It's kind of moved along that chain, and the learnings. And I love seeing a concept of an idea that was grown out of an emergency program that was literally slapped together in a matter of days and weeks that taught the industry that something could be done, and through those learnings, something good came out of it, entrepreneurial, out of the situation that was really, kind of intended to just fill a gap. And to see how it's grown and expanded into this has been really fulfilling.
Because that must be frustrating to know that there's food going to waste. There's food that they're growing that because of market conditions, they're plowing back under, or they're throwing it away, or they just can't, and it's rotting. And oh my God, we grew this food. Who could use it? I don't know. I'm the grower. I've lost track of how to get it to the public here. Yeah.
Right. And so we're able to come and help with that. And the kind of the stat on that we all quote is 30% of the produce that's grown never leaves the field. Wow. So that's a significant number that we can help. So if we can go create ancillary revenue streams for growers on that 30% they were throwing away, while at the same time positively impacting public health, who could argue with that?
Who can argue with it? Not me. Congratulations. Stick around for 1 second after we end here, because I got another idea of a show you can go on here and talk about this and spread it here. So stick with us when we hang up. Dr. Trinh, you've been quiet. What do you think of all this?
No, I love it. It's what we've been preaching all along, that your food should be your medicine, that food should be health. And here's Steve making it happen with that.
It sounds too good to be true, doesn't it, Dr. Trinh? It does sound like, what's the catch here? Something's wrong with this here. I got to go investigate this, right? Yeah.
Absolutely. No, this is great. Congratulations, Steve. Would love to continue chatting with you some more in the future and collaborating when you're back from your trips and all that. And we'll create a little brain box or something. We'll leave the happy box for later. That's a different box.
Yeah, the happy meal.
Brain box for now. Just the
create a happy
box.
meal that my grandson reached for instead of chicken McNuggets here. That might be a blessing in itself here. Right? Good stuff. All right, well, hang around because I want to give you one other idea off air, but one more reason. Take us out, Dr. Trinh.
All right, guys. Thanks so much. Thanks, Steve. Food is health. Food is medicine. Project foodbox.org. Go check them out. And see you guys later. Thanks for coming.
Thanks, guys.
Well, if that isn't an amazing discussion, I don't know what is. This isn't about what's just possible. This is what's happening. The pivots that take place when we have to make a sudden change in direction and the unintended consequences that result of all that. Project Food Box. Check them out. Right here in Orange County's only community radio station, OC Talk Radio, streaming live from our studios here at the University of California, Irvine's Beal Applied Innovation Center. Yeah, hi. Sorry, I just want to hold you for one more minute here. I think that is a fascinating discussion here. And let me just do one other thing. Hang on here. Okay. Yes. Anyway, we do a number of shows out of OC Talk Radio. We're out of the UCI's Applied Innovation Center here. And nice. I bet there's something at UCI here that would love to participate in this here. Some school of all these ecological food agriculture kind of things. More at UC Riverside, the agriculture stuff, than UCI here. But they're definitely into medical stuff. The suggestion I have is, if you haven't already, you should join the Hispanic Chamber of Commerce. They're based in our building, the Orange County Hispanic Chamber of Commerce. It doesn't cost much to join, and they have access to that community in a way few do. It's the business leaders within that community, and we do a show with them each and every week where they highlight members. And if you're a member, we could get you on their show, and you could talk about, hey, we're a new member and here's the new and they have all sorts of educational meetups and events and things. You could connect with the whole Hispanic community from top to bottom here.
That's a great idea. It's funny you mentioned that. Our outreach coordinator, because we are a minority-owned company, and my mother's side is I'm Hispanic, so we're
even more so. There you go. Right.
Even more so. And then it's funny because she said, you know, do you want to sign up for that? And I'm glad that you mentioned that, because my thought was kind of, well, it's a business group and they're going to be talking about businessy stuff, but sounds like it would be like-minded folks that we should be connecting with.
Go listen. You can check out their show here in Orange County. If you go just to, for example, YouTube, and check out the video versions of our shows, you can see the vast diversity of people they call community leaders, community activists, ordinary business people, giant corporations. Disney's on their supports them. President of Disneyland was on the show, and then a couple weeks later, there's a couple restaurateurs on the show from Santa Ana. You know, it's it's a wide, diverse group of people that they speak to and talk with, and a lot of politicians. So they're very connected to the mayors of Santa Ana and the mayors of Anaheim and all that kind of stuff. So they're obviously very politically active too. And it's just an amazing group that I think flies under the radar for most people. If you want to reach the community, it's a good point of entry.
Thank you for that. I'm gonna have her sign us up because I was just looking at an email on it yesterday.
Let me, if you send me an email, I'll forward it to the director here. They're in our building. Their offices are in the building. They do a show with us every week. That's what I thought. But they mostly focus on members of their, meet our community, they call it. And so it's not required that you be a member to be on the show, but that's where they do the first priority to all the people in there. Let me give you my email, and I'll introduce you to at a higher level than just filling out a form here.
All right, what is it?
Paul.Roberts,
okay,
at OC Talk Radio, one word, octalkradio.net, because we're in network.
.net.
And usually when they have new members, they like any chamber, they give you a little more highlight, a little more stuff and everything. It sounds like you're right at that tipping point where you want to reach out not only to the patients in Santa Ana who could benefit from this, but the other people who could spread the word, the community activists, I don't know if you ever work with the city councils, you ever work with public schools. I had somebody on talking about public schools and diets and all that kind of stuff and the challenges they have getting meals to kids in those communities. And that other guy, Bill Bracken, oh my goodness,
I met him before, and they're doing great work, and we kind of connected over email and social media and stuff. And
well, I'll introduce you to him too, because he's come in numerous times on other shows as well. He's just an amazing guy. This is his passion and purpose. He didn't know what to do with his life, and so from a terrible thing of losing a high-paying job to turning it into, I'm going to do something crazy. I'm not just going to get another job here. I'm going to create something. And out of a single food truck, built a whole movement here in the area here, and they got warehouses now and all sorts of stuff that they do.
Love it. Yes, I'll send you a note here, and then we'll connect.
And have you dealt with? It's not Nicole Sweetum anymore, who runs Second Harvest or whoever.
Oh, Claudia Bonias is real close, and then Mark Lowry over at OC Food Bank we do a ton of work with.
Yeah, there's a lot of those people that come through because we do a public affairs show where we focus on charities and stuff. That's where we had the new, I forgot the woman's name, who's the new director, recently new director at Cal Optum, I think, in the last year.
Yeah, there's one of the CEOs, Michael Nunn, and then there's a COO that runs a lot of this programs, and then YK is her name, and then there are several people who run the community supports, of which we're underneath, and that's Kelly Bruno and
Kelly Bruno. That's who we had on, Kelly Bruno.
Yeah. So those are the kind of folks that, it's kind of interesting. Cal Optima, you mentioned like how we get paid. So we get reimbursed just like if we delivered a medical prescription and we're a pharmacy, right? So There's a prescribed rate that you get for a medically tailored meal box, and we get that. But and so it's an interesting benefit how they've kind of plugged that in. So when we're the way I look at it and the way our people treat people is like the members are the customer. Cal Optima is the one paying the bill.
Yeah.
But it's member satisfaction that's going to lead the day at the end of the day. Right?
And the thing that I find most disturbing is when Kelly came in or other people come in, there's lots of innovative, interesting programs for housing, for veterans, for food now, and all these different things. But it's disseminating that information down to the people who need it. And there isn't a big, giant one source where we get all our information, a newspaper, a news channel. We've filled some of that mostly for business community, but it's still a struggle getting the story out to people here.
Yeah, exactly. And that outreach part was something that we didn't think initially that we were going to be charged with or part of.
Yeah, we'll do it. You just tell us who to give it to. Yeah.
Yeah. Because that, obviously for obvious privacy reasons, they can't just give you the list of people and go here, call them.
Right.
So but we've become quite creative in finding, where they are. And I mean, we're not going to set up a booth in, Laguna Beach. We're going to hang out in Santa Ana and Anaheim and Orange and these areas that have the most challenges and hire people who are from those communities, who have lived experience, who have been on Medi-Cal, who know what it means and know how important this benefit is. And they're able to make a connection with those folks that I never would be able to make.
Yeah. And the other thing that Dr. Trinh pointed out when we were going through all of this COVID stuff, they were trying to reach these impacted, these high-risk communities, Vietnamese, Spanish speaking, all this stuff. They don't trust you. You can't just walk in the door and say, "Here I am," and they go, "I don't know who you are or where you came from, but I'm not talking to you."
Exactly right. We see that all the time. Yeah. So like that has probably been the secret sauce.
So I think that's why you have to partner with. There's a Persian chamber. There's a Hispanic chamber. There's a Black chamber. There's some of these other chambers that I'm not just touting chambers. There are other groups and organizations and people, but you got to find some way in, somebody that brings you in and say, "Hey, they're for real. They're okay. I like these guys."
And when I think about the Hispanic Chamber, just 2 days ago, I was over at Northgate Markets. I'm good friends with one of the Gonzalez family members who's in a business group with me. And we went there, and then I didn't realize that they offered like community services within their stores. You know, they partner with these nonprofits to do health screenings.
They're big members in the chamber there. They're big believers. They're longtime members of the chamber. I think they're one of the founders of the chamber or something.
Right. And then so I was talking to Oscar about this, and I said, what an opportunity for us to utilize some Northgate items in the box, like the beans and rice or something like that. And then, hey, we throw a coupon in there to also that provides value to a member that eventually is going to become a shopper at your store.
There you go. Even better. Yeah. Right.
And then, so like we think about all these ways to connect these community partners. When we find somebody whose qualifying health condition is asthma, we refer them to the organization that's doing asthma remediation. So they'll come in your home, rip out all your old crappy carpet that's causing all that stuff to go into the air, and then kind of whatever filters or whatever they put in there. If you're wheelchair bound and your doors aren't wide enough, they'll come in and break out the doors and put handles in your bathroom and stuff so you can move around. So all these like whole person care items, but the ultimate goal is obviously comfort and health of the member. But there's a financial side of this that can't be overlooked, which is the amount of money that we're spending and pumping. To give you an idea, but here's what blew me away too. The federal annual budget for health and human services is 1.4 trillion with a T.
Right.
The budget for the United States Department of Agriculture is 150 billion with a B. So that's still significant, but look at the comparison of what we're spending on health and reactionary health and how much we're spending on the food that would actually make us healthier.
We don't understand food anymore. It just arrives. And so we don't place much priority on it. We don't think about it. We don't understand the challenges of farming. I don't know a farmer. I don't hear about farmers are in Iowa or in the middle of the country or someplace here. So there it reflects, we don't have presidents from farm districts. We don't have, I'm sure there are powerful politicians that preach and teach this stuff, but that we're not an agricultural country in the way we were 100 years ago.
And they created this food system in the 20s, 30s, 40s when population was booming. We needed calories, just food, period.
Right.
And now we're past the point of needing just food for the sake of food. And now we've created these monoculture growing conditions in the Midwest where all they can grow is just wheat after wheat after wheat after wheat or whatever the crop might be.
Or beef or something, or whatever.
Whatever the case is, and kind of taking away a lot of the diversity in terms of the stuff we can grow, right? And so now there's this pivot going on or trying to go on of a little bit more sustainable regenerative practices and maybe crops that are more appropriate for specific growing regions as opposed to growing them just for the sake of
I never knew why they grew cotton in Texas or where they grow it in the Imperial Valley or something. There are other places that water intensive crops like that maybe should go instead of or alfalfa or something.
We're going to see a seismic shift of, alfalfa, a certain percentage of that gets shipped to overseas for dairies for other countries that don't have the resources to grow their own. And so, I think there's just going to be a mind shift, but it's our job to provide them with other crops that they can plant and achieve sustainability in terms of financial sustainability. So it's I think collectively our job to identify those crops that they can grow. They don't, like I said, a farmer will grow anything.
Right.
As long as it's needed and wanted and contracted and they have an ability to squeak out a little something, they'll grow anything. So,
and that's why I always like the idea of expanding our food palette. I grew up in the Midwest. There are 5 foods I ate. Most of them started with there were a meat. It was beef, chicken, whatever, and the idea that those are the only foods humans can eat. I'm not even pushing. My wife's a vegetarian. I'm not even pushing into that realm here. But there are more creative things that maybe have better nutrition and better value for us here than the crap. Particularly the manufactured fake stuff, the Cheetos and Fritos and all that stuff that we're all addicted to as Americans here. I just think there's a whole world of food discussions that doesn't get talked about. Food just arrives. and you have it or you don't. But you know, it's we don't think about what we eat, how we're starting to get more conscious of calories, and we're getting conscious of health benefits. But I think we still got a long way to go.
I agree.
All right. Well, thanks for that. I'll put you, send me the email. I'll put you in touch with them. That might be a point of entry for you. And I'll try and think of other ways we can spread your story here.
Thank you so much. I appreciated it.
All right. Thanks. All right.
All right. Bye.